Hey, Joe Zarzaur here with Dr. Malone to discuss a little COVID Omicron update. We last spoke, I think, before Christmas, Dr. Malone, if I'm not mistaken, and we were talking about this Omicron thing coming about and this variant and how to handle it and what to do about it. And I think we actually published some information about the effectiveness of the booster against the variant, and you showed this illustration where unless you had the booster plus the 2 doses, you were not protected from Omicron.
Yeah,
I heard you say that. I looked at the sheet that we put out there, and I thought to myself, well, yeah, that's probably true for people that didn't have the virus as bad as I had the virus. So I'm not concerned about getting Omicron because I had a hell of a case of the virus back in September of 20. And
wild strain.
Wild strain, they call it. And I thought to myself, with a really bad case of the wild strain and 2 doses of Moderna, I should be good to go. By the way, both doses of Moderna caused me to have horrible symptoms for 24 to 36 hours. Fever, chills, felt like I had the virus again. So I'm thinking my body has got enough antibodies in it to where Omicron doesn't have a chance. So of course, I went and worked in the Miami office and then spent New Year's in Miami. And of course, Miami is basically, I think, Omicron Central. And I came back, and on January the 4th, I did one of the tests, right? Because I had a little sniffle. I went to a mediation, not physically, but Zoom mediation. And I started getting some sniffles like that. And I started feeling like, a little feverish, but no fever. And I did a test and it was positive. I'm like, oh, here we go again. So for the last week, until yesterday, I have been dealing with COVID and Omicron, I guess. And fortunately, no fever, no chills, slight scratchy throat, not even sore, like scratchy, tired, fatigued, didn't feel like working out. And so here we are now, 8 days after my positive test and negative test now. And I am, again, COVID-free, but I did have a week's worth of Omicron. I'm not doing this video to debate the effectiveness of the vaccines or the booster or whether you should do it. I don't really care. If you don't want to be vaccinated, it's your business, good for you. I hope it works out for you. If you think vaccinations kill people, maybe that's the case. I don't know. There's a lot of smart people that would be completely wrong, right? Of course, smart people have been wrong before, but I'm still going with the science on this. The science says the vaccination works and that even with Omicron, the death rate has not gone up like it did with Delta and Beta. So what I wanted you to do, Dr. Malone, is again, since we've been doing this since the beginning of this virus, I'd like you to weigh in as a medical doctor with training more than the average bear. What we're dealing with now, what is the effectiveness of the Omicron against the booster? Do you have any change in any opinions that you had prior to Christmas when we published that study that showed that if you had the double vaccination plus the booster, it was a really serious protection against even Omicron? I'd like you to just sort of give us here locally in Northwest Florida, just your take medically on where we are with Omicron and what your opinion is in regards to the booster plus the 2 doses.
Sure. So I guess I'll start off by, dovetailing off of what Joe detailed with his recent bout of Omicron. And, he did everything right. So he didn't blow it off and say, oh, I've already had it, this can't be it. He did the right thing. I guess, he locked it down and he tested and he listened to his symptoms. The people that are either not testing or are doing one antigen test and hey, it's negative and I'm still symptomatic, I'm gonna carry on. We do know that the antigen tests aren't picking up, so you need to do this serial testing like we mentioned in the last video. That's why these tests come in packs of 2. So you do a test that's negative, you do another test 36 hours later, or you pursue PCR testing. So anyhow, so that's as far as if you think you're symptomatic. And the symptoms generally are the more mild kind of cold-like symptoms, and that's across the board with the people that we know, at least locally in our bubble here, that have had Omicron. It's the head cold kind of symptoms. It's not the difficulty breathing, and it's not really a full-blown fever necessarily. It's more the headache, myalgias, and a little bit of the rhinitis and the drippy nose. As far as booster or not, the study that we did share, I still stand by it as far as the booster's effectiveness. I think some of the groups that they analyzed in that, they didn't account for, one of the weaknesses of the study was they didn't account for or were not able to account for who had had the various strains of the virus as to whether or not they had some sort of innate immunity with, if they had wild strain or beta or delta or whatever. I think there have been other studies that have come out since then where they've tried to isolate, okay, let's look at some delta, people that were infected with delta and see how they are dealing with Omicron like that. So I think those are unfolding as we go along. I don't think they're really that important because the message is still the same, meaning if you've been infected, you should still seek boosting, especially if you've already got 1 or 2 doses. You may as well go through with that last dose. It's a half dose. The side effect profile for the 3rd dose is really minimal from the people that have had it. I've had it and I had Delta and I didn't have any symptoms at all. So that's as far as the booster. You can get it readily available in the community. I personally just walked into East Hill Pharmacy, didn't need an appointment, and it was available to me. I know that others have said the same thing. So your local pharmacy can probably serve your needs. As far as our numbers, Joe has mentioned that, yeah, we're seeing the boom. So in our last video, locally our numbers were, we're seeing like 100, 200 cases a week in Escambia County, and we had been kind of averaging that range for a long time. The highest numbers were, again, back in August and September, we're in the thousands per week as far as new cases. And since that time, as of this Friday, we're going to share the link, we're at 3,700 cases in Escambia County, which that sounds horrible, right? Put in perspective, Dade was 110,000 last week. So we are seeing a proportional uptick, just like Dade is seeing there too. The better news is the deaths statewide are not jumping. So statewide, we've been 20, 30, 40 range per week of deaths for the last many months. The highest number was like almost like 400 deaths a week, and that was back in September. So we have not had that jump, and nationwide, we have not seen that jump in relation to Omicron. So that's the good news.
All right. What's the deal with this test? I like to be fair in my criticism. So let's criticize if the availability of these home tests. I think it's ridiculous that we're this far into this virus and I have to basically do drug deal like transactions with people I know that have home tests so I can get a home test to check and see if family members have the Omicron virus. Why is it at this point in this process, we can't get a home test at the pharmacy? Why is that? Medical point of view, I don't have an answer for you. I think they should be widely available. I think that it should be low cost and high supply. I don't have a good answer for you there. You can get plenty of other home medical needs much easier than a home antigen test. And so I don't know why we can't get those. I don't get it. There's a demand for it. So you would think the private companies would be like, I think everybody saw the vaccination as like, this is over. Like, we are done with this. Like, we thought we were going to go downhill, but the vaccination happened and we are now done. I don't think anybody thought there'd be resistance to the vaccination like there has been. And the resistance to the vaccination has allowed for all this stuff to creep up, right? But we should all have assumed that there's going to be different vaccination rates across the world, right? And like Omicron came from a place where the vaccination, Vaccination wasn't even available until more recently. So shouldn't the scientists have hypothesized that, okay, well, we're going to have at least 2 or 3 more variants because the whole world has to be completely rid of this before all of us are rid of this. So why didn't the scientists, whoever you want to say, fill in the blank, CDC, FDA, Health and Human Resources, whoever, right, the NIH, why didn't they anticipate that we were going to have multiple variants even after the vaccination was available? And why didn't they then say, okay, we're going to have a variant that's probably going to cause infections like this, that could, this 9 times more transmissible than Delta, right?
Yep.
And let's go ahead and ramp up everything, testing, availability of PCRs, availability of home tests, mitigation strategies, contact tracing strategies. Let's ramp up everything until this thing is completely in the rearview mirror. Why was there not more of that? Is that a political question? Is that a medical question? I don't know. Maybe I should be asking you, but
well, I guess one thing that comes to mind is I know on the home tests that I've participated in, they all have expiration dates on them. So I imagine ramping it up, you got to ramp it up during the sweet spot. So I guess you could miss that and have wasted tests or tests that are bad or inaccurate. So that's one medical thought. That'd be a whole.
By the way, if you have an expired home test and you want to get rid of it, I'm happy to buy it from you. I don't think at this point, if I'm buying them off the street, like a drug deal, not that I've ever done a drug deal, but if I'm buying them off the street from people, I mean, I don't really give a shit if it expired last week, right? I don't care. I want to test to see if my daughter can be around my parents, for instance, or I can be around my staff. I just don't understand why these aren't like filling the shelves in a whole section of the pharmacy. And by the way, I think PCR tests should be over the counter at this point too. I think it's ridiculous that we have to go do an antigen test and then go somewhere else to do a PCR. It all should be something we can do at the house at this point. I mean, this is ridiculous in my opinion at this point. We've been doing this long enough in America, 2 years now, to where this stuff should be available at this point. And there's no excuse for any administration to say anything at this point because you knew what you were dealing with. So you probably don't have an answer for all that. But can I ask you this, doctor?
Yeah.
If you had Omicron, you didn't have the booster, and you got Omicron, like me.
Yep.
Should you now get the booster?
All the recommendations are to go ahead and get the booster.
Make the best argument to me now that I should get the booster. After having wild strand, having Omicron, tell me why I now should get the booster.
Because we know that the booster was effective against Delta, and Delta is still out there. A lot of the hospitalization and the death data you're seeing from other parts of the country, thankfully not in our area, are related to Delta. So they're starting to tweeze out the Omicron versus the Delta, and they're finding more of the Delta people are more sick, obviously. So that'd be, I guess, the medical reason. As far as going back to my recommendation of getting your booster, you would get your booster after you're done with your isolation and all that kind of stuff, where it's safe for you to go to the pharmacy to get it. Okay,
very good. All right. Are we putting anything on this post or any literature?
Yeah, we have 2 links. I'll just share them very, very quickly here. One of them is the release from today from Escambia County. And I'll just put this in perspective. So we have 176 current hospitalizations that are related to COVID. At the peak during, I guess, Delta, we were over 400, and that's when we were all like, 3 alarm fire kind of stuff. The trend as of a week ago, we started at about 115, give or take. So it has ticked up a little bit. I think resources wise, there's plenty based on everything that's been in the news for the hospitals and things like that. So we're not at a stage there. Staffing, however, I'm sure it's strained, asking people to pick up extra shifts and things like that. So keep that in mind when you're seeking medical care locally. As far as the data release, we'll go ahead and put that up as well. But I do want to share, again, this is the last page of the data release, which we'll put up there. And it's the one that I guess is the best news of all of this. That loads here. It is right here. These are the deaths, statewide deaths. And again, we haven't had an uptick, and this is something if you see on the far right from October 8th through December 31st, there's not been a huge uptick. It's been pretty static. So that is the good news. Again, that doesn't mean ignore Omicron. It just means that.
Here's the issue though, and people don't think about this. If this thing is 9 times more transmissible, that means more people, a lot more, 10 times the people are getting the virus, right? They're getting symptoms, which then puts them out of work, right? So if you have a 10 times greater chance of having symptoms, right, then more people are going to be out of work than with any other strand of the virus. That's why the hospitals are having issues, transportation facilities, airlines, they're having too many people with symptoms, right? Because it's 10 times more transmissible, even though those people are not dying or not getting in the hospital, most of them, but they're still having symptoms and they're still testing positive and they still have to be home.
Yeah,
So,
and you're talking about industries that don't have the option to work from home.
Industries don't have what?
Don't have the option to work from home.
Correct.
So
Correct.
you can't provide healthcare from home. You can't work in airlines from home.
That's correct.
But office staff, you can work from home and there's less disruption.
Right. So if for no other reason than economics, it makes sense to have this booster and try to avoid Omicron, because otherwise you're going to put, especially if you're in an industry that doesn't allow for working from home, you're going to slow down the wheels of the economic process or system, such that we're going to have issues economically now, just from a non-fatal, for the most part, strand of the virus, shutting everything down. Healthcare system, we need those people in the hospital to care for the few that are actually getting admitted. So from a personal injury standpoint, a lot of the clients that are involved in car wrecks now are getting to the hospital. And even though the hospital numbers are not ticking up, if you have 10 times more infections, percentage-wise, the deaths are not going to seem more, but you still could be affecting a large swath of people that have severe illness because the numbers are higher. If 10 times the people are becoming infected, percentage-wise, the deaths don't look that big of a deal. But you're still overcrowding the hospitals. I had a client that was involved in a wreck in Birmingham over the holidays. They tried to go to the hospital in Birmingham. It was an interstate collision. Tried to go to the hospital in Birmingham. They got turned away, said it was an 8-hour wait. Okay. They went to their relative's house in Nashville, got there, went to a hospital there, got turned away in Nashville. And these are major trauma centers they're going to. And so this is my long way of saying the healthcare system is feeling strained now from just the sheer number of people that have symptoms that happen to be employed in healthcare. So keep that in mind when you decide cavalierly to not get the booster, when maybe you should, because you could pass this on to somebody who's in the healthcare business, right? And most of our families have somebody in the healthcare industry business.
Joe, let me add the other thing that I guess we've encountered is, you can be completely healthy and you have a family member who, like children who can't go to school because they've had an exposure or they're sick. And all of a sudden the parent then is staying home with a kid who can't go to school because there's no other option for the child during the day. So it's trickling down, I guess. Yep. So we're seeing logjam as well.
It feels, just based on what I'm gathering from my daughter's school getting shut down this week here locally, to other things that are happening around people that we know, that we're hitting the apex for Omicron either now or this week. And it seems like Miami has hit the hump already apex wise and is coming down. So my hope is that we're going up and we're hitting our apex either this week or early next week.
It should be 2 weeks or so based on the data for using those for our projection.
Okay. All right. So folks, you still have time to protect yourself. If you don't have symptoms, you hadn't gotten the booster, I'd go get the booster. If you do have symptoms, stay away. Even though it's going to feel mild, you should stay away from other people. Okay. I did that for 8 days. So, all right. If you have any questions, you can find us on the web at zarzaurlaw.com. As always, we're here 24/7 working on our medical malpractice, car wreck, injuries, boat accidents, all types of personal injury cases. Y'all take care and stay safe. Thank you.